Stop showering every single day. I'm serious. If you're over 60 and you've spent your whole life believing that a daily shower automatically means better hygiene, what I'm about to share may completely change the way you think about cleanliness, skin health, and even independence as you age. Because here's the part most people never hear. As we get older, our skin becomes thinner, more fragile, and much drier. It also makes less of the natural oil that helps protect it. And when you combine aging skin with hot water, harsh soap, and overwashing, what feels like a healthy habit can quietly become the very thing that damages your body's first line of defense. I'm Dr. Vance, and for years I've worked with older adults dealing with fragile skin, chronic dryness, irritation, wound healing problems, and the everyday routines that either protect health or slowly work against it. And one of the most misunderstood routines of all is something people almost never question: bathing. Before we go any further, I want to ask you two things. First, tell me your age in the comments. Second, tell me how often you currently bathe or shower. I read those comments, and I always find it fascinating how many people were taught one rule their entire life, only to discover later that their body changed and the old rule no longer fits. Now let me give you the tease, because I'm not going to make you wait until the very end for the biggest surprise. Coming in at number 2 on today's list is a bathing frequency that sounds completely wrong at first. In fact, most people hear it and assume I misspoke. I didn't. Let's count down from 5 to 1. The bathing frequencies and principles older adults should know, from reasonable to absolutely essential. Number 5. 3 full-body baths or showers per week for many older adults. This is where a lot of people are going to pause and think, wait, only 3? Yes, for many older adults, especially those with normal mobility and no heavy sweating or incontinence issues, bathing about 3 times a week is often enough. And the reason is simple. Older skin is not younger skin. With age, the skin becomes thinner, loses some of the fat beneath it, and produces less of the natural oil that helps lock in moisture. That means every long shower, every hot bath, and every aggressive scrub takes a bigger toll than it used to. What used to bounce back in your 30s may not bounce back nearly as easily in your 60s, 70s, or 80s. Think of it like this. When you're younger, your skin is more like a newer leather jacket. It has flexibility, oil, and resilience. But with age, that same jacket becomes drier, stiffer, and easier to crack if you keep washing it too harshly. That's what many older adults are doing without realizing it. They aren't cleaning their skin, they're stripping it. I had a patient once who told me, "Dr. Vance, I've showered every single morning since I was 22, and I thought the tightness and itching afterward was just normal aging." It wasn't. It was her skin barrier asking for help. When she cut back to 3 showers a week, used warm instead of hot water, and stopped soaping every inch of her body every single time, the constant dryness improved dramatically. The practical tip here is simple. If you're an older adult with normal activity levels, try full-body bathing around 3 times per week instead of automatically showering every day. Focus soap on the areas that actually need it most, like underarms, groin, feet, and any visibly soiled skin. And here's the synergy tip. Apply a fragrance-free moisturizer within a few minutes of getting out, while the skin is still slightly damp. That single habit can make a bigger difference than most expensive skin products ever will. Number 4. Daily partial cleansing, even when you don't do a full shower. This is where people get confused. They hear, "Don't bathe every day," and they assume that means doing nothing in between. That is not what I'm saying. Many older adults do best with less frequent full-body bathing, but daily cleansing of certain areas still matters a lot. Your face, hands, underarms, groin, and feet may need attention every day, even if the rest of your body does not. Why? Because these are the areas where sweat, bacteria, odor, skin fold moisture, and irritation build up fastest. So while your arms, back, and legs may not need a complete soap and water session daily, those higher risk zones often do. Think of your body like a home. Not every room gets dirty at the same rate. You don't deep clean the attic every single day, but the kitchen counters, the bathroom sink, those need more frequent care. The same logic applies here. One older gentleman I worked with kept getting redness under his arms and irritation in the groin area. He assumed he needed more full showers, so he started bathing more often, but that actually made the dryness on the rest of his body worse. What helped wasn't more full-body bathing, it was a better targeted routine. A gentle daily washcloth cleanse for the face, underarms, groin, and feet, and fewer full hot showers. That's the distinction a lot of people miss. The practical tip here is to keep a soft washcloth and gentle cleanser ready for a 1 or 2 minute targeted cleanup on non-shower days. And the synergy tip is this. While you're doing that quick cleansing, take 10 extra seconds to look for redness, cracks, rash, or any skin breakdown. Early detection matters much more in older adults because fragile skin can worsen fast once irritation starts. Number 3. Sometimes 2 to 3 full baths per week is even better if your skin is very dry. Now we're getting into the part that surprises people even more. If your skin is constantly flaky, itchy, tight, or irritated, more washing is often not the solution. Less may be. That doesn't mean poor hygiene, it means smarter hygiene. A lot of older adults confuse the feeling of dryness after a shower with the feeling of being freshly clean. But those are not the same thing. If every shower leaves your skin feeling stretched, itchy, or uncomfortable, your routine may be too aggressive for the skin you have now. And remember, aging skin doesn't just get drier, it also heals more slowly. So if you keep triggering irritation, your body may never quite catch up. This is especially important if you already have eczema-prone or highly sensitive skin. In those cases, it's not only about frequency, it's also about what you use, how long you stay in the water, and whether you moisturize immediately afterward. I remember a woman who kept telling me, "I feel dirtier if I skip a day, but I also itch all night after I shower." That sentence tells you everything. Her body was clean, her skin was overwhelmed. Once she moved to 2 or 3 shorter baths per week, switched to a gentle fragrance-free cleanser, and started moisturizing right away, her evenings became much more comfortable. The practical tip here is to experiment carefully. If you have very dry skin, try reducing full-body bathing frequency slightly and watch what happens over 2 weeks. Does the itching improve? Does the flaking improve? Does your skin feel calmer? And the synergy tip. If your skin is very dry, use cream or ointment rather than a thin lotion. Thicker moisturizers usually do a better job sealing water into older skin. Now, before we get to the top 2, if you've made it this far, take a second to subscribe and hit like. I say that because so many older adults are still following skin advice that made sense decades ago but doesn't fit the body they have now. And when you engage with this video, it helps this information reach someone else who may be dealing with the same dryness, itching, or fragile skin and not realizing the cause is sitting right there in their daily routine. Number 2. Daily cleansing can be the correct choice, but only for a very specific group. This is the one I teased earlier. And yes, it sounds like it contradicts everything we've said so far. But it doesn't. Because the truth is, older adults are not one category. Some people absolutely do need daily cleansing, and in some cases, they need it urgently. I'm talking about older adults dealing with incontinence, heavy sweating, skin folds that stay damp, wound drainage, or anything that repeatedly leaves moisture against the skin. In those situations, the problem is no longer overwashing. The problem is prolonged moisture exposure. And moisture-damaged skin breaks down fast. If you've ever left a bandage on too long and seen the pale, soggy skin underneath, you already understand the basic idea. Skin that stays wet becomes weaker, softer, and easier to injure. Now imagine that happening again and again on aging skin. That's where real trouble starts. For older adults in this category, prompt cleansing after exposure matters. Not harsh scrubbing, not strong soap, not long hot showers, but gentle cleansing, careful drying, and barrier protection. This is especially important for caregivers listening right now. I've seen family members avoid frequent cleansing because they're afraid of drying out the skin, not realizing that constant exposure to urine, stool, sweat, or wound drainage can do much more damage than gentle cleaning ever would. So this is where the rule changes. If moisture is repeatedly sitting on the skin, cleansing may need to happen daily, or even more than once a day, depending on the situation. The practical tip here is to use a gentle pH-balanced cleanser or a no-rinse cleansing product if full bathing is difficult. Avoid scrubbing. Pat or blot instead of rubbing. And the synergy tip may be one of the most important in this entire video. After cleansing, use a protective barrier product if needed, especially in high-risk areas. Products with ingredients like zinc oxide, petrolatum, or dimethicone are often used to help protect skin exposed to repeated moisture. And now number 1. This is the most important point of all. More important than whether you bathe 2 times a week, 3 times a week, or every day in a special circumstance. Number 1. How you bathe matters more than how often you bathe. This is where almost everyone gets the conversation wrong. They obsess over frequency. But frequency is only part of the story. A short, warm shower with gentle cleansing and immediate moisturizer can be far better for older skin than a twice-weekly scalding hot bath that lasts half an hour. Hot water is one of the biggest hidden offenders. It feels relaxing. It feels therapeutic. It feels clean. But it also strips natural oils, weakens the skin barrier, and can leave older skin drier and more fragile than before you got in. And long water exposure makes that worse. So if you remember nothing else from this video, remember this. Older adults should not just ask, how often should I bathe? They should ask, how hot is my water? How long am I staying in? What cleanser am I using? And what do I do right after? That's the real question. I once had a patient who told me, Dr. Marcus Vance, I only bathe twice a week, so I know I'm not overdoing it. But when I asked more questions, I found out those were very long, very hot baths, followed by no moisturizer at all. So technically, the frequency sounded conservative, but the method was doing the damage. Once she shortened the baths, cooled the water down, and moisturized afterward, her skin started looking and feeling healthier within weeks. That's why method beats frequency, every time. The practical tip is this. Keep showers or baths short. Use warm rather than hot water. Choose a mild, fragrance-free cleanser, and avoid scrubbing with rough cloths or loofahs. And here is the final synergy tip, the one I want you to remember most. Moisturize within the first few minutes after bathing, not an hour later, not at bedtime if you showered in the morning, right after. That's when your skin has the best chance to hold on to moisture instead of losing it. So what's the real answer to the question, how often should older adults bathe? For many, around 2 to 3 full-body baths or showers per week is enough. For some, 3 is ideal. For some with very dry skin, even fewer full baths may feel better. For others dealing with incontinence, heavy moisture exposure, or wound-related issues, daily cleansing of affected areas may be necessary. But in every case, the best routine is the one that protects the skin instead of punishing it. And that brings me to the part of this conversation that matters most. This isn't really just about bathing, it's about preserving comfort. It's about protecting the skin you live in every day. And for many older adults, it's about protecting dignity, mobility, and independence. Because when skin breaks down, everything gets harder. Dressing gets harder, sleeping gets harder, moving gets harder, healing gets harder. But small routine changes can make a surprisingly big difference. Slightly fewer showers, slightly cooler water, a gentler cleanser, a better moisturizer, a more targeted approach instead of an automatic one. That's how better health often happens in real life. Not through dramatic interventions, but through everyday habits finally being adjusted to match the body you have now. If you found this helpful, subscribe to the channel and share this with a parent, spouse, sibling, or friend who still thinks daily hot showers are always the healthiest choice. And before you go, tell me in the comments, what surprised you most? And after hearing this, are you going to change how often you bathe this week? I'm Dr. Marcus Vance, and I'll see you in the next one.